Hey guys, it's Dr. Jackson again from the Sports Pod. Nice to see you again. Thanks for watching, guys. Really appreciate it when you come in and watch our videos. Without you guys, we wouldn't be able to really, do what we want to do and see as many people as we'd like to see. So I just want to say thank you guys first off. And today I'd like to kind of talk a little bit about a previous video I've done with Coach Justin Estes over at CrossFit Garland. We talked a little bit about how to actually correct your squat, especially if you have kind of knocked knees when you're doing a squat. So the method that we went over was a banded approach, where you take a band, you put it around your knees, and then you actually perform squats. So the reason that we like doing that exercise is because it's very active, but also you're strengthening muscles that are actually going to help open up the hips and keep you from having that kind of knock knee presentation. So I just want to talk a little bit today about maybe why you may have knock knees when you're doing a squat. There's a couple different options here, and then in another video I'll kind of follow up with maybe one or two other exercises you can do in addition to banded squats that are going to help you with this presentation. So you can have knee valgus, which is what we call it, or medial collapse of the knees, knock knees. It all means the same thing. You're doing a squat and the knees come in. And so some of the reasons you may have this presentation is because your groin muscles, or the muscles on the inside of your thigh, your adductor muscles, are very tight. So when you go and perform a squat, it just wants to pull you in. So that's one reason why you may have valgus or kind of knock knees when you're squatting. And that's just a matter of decreasing tension in those muscles, stretching those groin muscles, and then oftentimes that'll clear it right up. So sometimes it could be something else, such as a weakness actually in the glutes and the external hip rotators. So like your glute med, your glute min, your TFL. Sometimes those just aren't firing, or they're weak because you haven't strengthened them on a regular basis, and then they can't actually bring the hips out, and then they're going to collapse inwards. So, and sometimes it's a combination of the two. So maybe you have really tight adductors, but you have really weak abductors and external hip rotators, and so it all just kind of creates this perfect storm, and then you have knock knees during a squat. So those are just some of the reasons why you may have knock knees. Now there could be some other reasons to explain this, but those are the most common and that we see in our office. And oftentimes just doing some simple soft tissue work to work out the tension in the adductors, also activate the glutes and fire the glutes, and then strengthen those, usually cleans it up pretty quickly. So I'll follow this up with a video on 2 or 3 exercises which you can do to kind of correct this. I hope you learned something from this video. Feel free to comment down here. You can reach me via social media in this left-hand corner. Hope to hear from you soon. Once again, I'm Dr. Jackson from the Sports Pod, and move free.